this is Jennifer Hart from ZIA Be Well. Back again. I'm very excited. We are showcasing local businesses of the holistic nature, but fitness and wellness. And we spoke last week about how everybody has a different um, view of what wellness means. Oh yeah, I have wellness, and they're like, they could be a no neck bodybuilder, or they could they could have a wellness center. They could be, just doing something for themselves to heal. And so I really appreciate the art and the practice of acupuncture, and I am very fortunate to have my acupuncturist come. This
Hello.
this is Jen from Yin Acupuncture, and
Hello.
it's funny because when I started, having acupuncture back in the day, it was very like, "Oh my god, it's gonna hurt. Oh my god, what is it gonna do? That's voodoo or something crazy." And anytime somebody doesn't know about something, they're gonna say like, "That's stupid," or whatever. Because literally, some of the practices that I've been doing with the holistic medicine over the years, they told me, "You're stupid. That's stupid." I'm like, "Why? Because you don't know about it."
Right,
And not everything is for everybody.
right,
But and you find
right,
things that work for you. But
right. That's true.
acupuncture, I would do any day before I would take a pill, or, and I find it's just redirecting the energy. And Jen, you can correct me and elaborate on that, but it's redirecting energy, redirecting nerve endings, and that's what I get out of it. So what have
Yeah.
you found that people like when you say I'm an acupuncturist,
Yeah.
or they ask like, is this for me? Like, how do you
Mhm.
approach the whole situation?
Well, I've been in practice for 18 years, so the attitudes about acupuncture have actually changed over time. I think people are more familiar with it now.
More open.
Yes. It used to be thought of as kind of like a woo woo thing.
Yeah.
And like you said, some people would say, oh, that's not real, or that doesn't work without having any experience or really understanding what Chinese medicine is or about.
Yeah,
Um,
they're quick to
just
judge
dismissed. Yeah.
and dismiss it, yes.
Now I find nobody has that attitude, to be honest with you. Even
Right.
doctors seem to say to their patients, if it's work at the very least, hey, if it works for
That's
you,
right.
because they know that it's as long as you're going to a licensed um, practitioner, then you're safe. It's a safe practice.
And I'm glad that it's come that far, because I was being a
Yeah.
wise guy when I said that earlier, like, but literally people are like, "You're
Oh,
crazy,"
yeah.
but I'm like, it's so accepting now, and
Mhm.
I would choose this first. And
Yep.
I appreciate that a lot of Western doctors it'll be a
It's a
complement to
complementary
their
treatment.
therapy
Yes,
and their
exactly.
treatment. Yeah.
You can do biomedicine and acupuncture together. There's no contraindication at all between the two. The only thing I tell people is if you've just started a new medication and you're just starting acupuncture, we're not going to be able to decipher which one is the thing that's helping. So, to try to sort of stagger the start of more than one thing, start one thing at a time, basically. Um, and as far as attitudes now towards acupuncture, just to get back to finish one of my thoughts, most people think it's just for pain, which it is for pain, very effective for pain. In fact, they've found that there are many studies now that show that acupuncture can be more effective for pain than opioids, and obviously we have a big problem with that. So, um, but it's not just for orthopedic pain, it's also for different organ functions and pretty much anything you could think of, you could at least attempt to treat with acupuncture and mostly successfully to an extent,
That's
one way
what
or
I
the
was
other.
gonna ask you
Yeah.
too. I was gonna say, now have you found in your practice, we learn every day, do you find like, wow, this is in your studies and helping others, wow, this also helps this, you know?
Yes. I mean, when you're trained, you learn the entire body. It's a master's degree that you have to have in either acupuncture or um, acupuncture and herbal medicine. So they're both masters of science, and so we have to learn a lot of um, biomedicine as well as Chinese medicine. They're taught separately, but you wind up having a really good grasp on sort of all of the things that people typically are
You
suffering
have
from.
to, I would
You do.
imagine.
And
I
so
mean,
you can understand prognosis, research. We had to take research classes, all kinds of things so we can understand reading, good medical papers versus this isn't the greatest study in the world, whatever it is. And all of it helps to inform, how someone's going to do with acupuncture. So, of course, I'm losing my train of thought because I do that.
it's okay.
What was the last question that I was
Just
answering?
that you found that I know because I do the same
Pain.
thing.
Was it about pain?
Well, no, I mean, as you're taking care
Oh,
of your patients,
yep.
like, you're learning, you're like, "Wow, acupuncture also helps
Yes,
this ailment and
exactly.
condition."
Yes. So the good thing about acupuncture is when you're treating someone for one thing, even if we usually discuss most of the processes in the body regardless if you're just coming in for knee pain, we still might discuss your digestion just to get a holistic view of your entire body and how it's functioning. But even if I'm just treating your knee locally, those points like you mentioned before the central nervous system, they now can see that the some of um the function of acupuncture is attributed to the central nervous system. So you're able to stimulate the brain and affect other parts of the body, even though I'm just putting needles around the knee. So you
Right.
might have, slightly off digestion, but don't think much about it. And the next thing you know, after you've come for several knee treatments, you're going to the bathroom every day.
No, true,
you
and
know?
and that's what I
Yeah.
was saying, like, I remember I have come in and I said, "Okay, this is what's going on, I've got gut health."
Yep.
But it's not just about gut health. It's
Right.
like, I know that you treated another organ
Hmm.
to help me because 'cause I'm like, "Why do I feel like, I just feel chill," you
right.
know?
Right.
And it was like, you were treating my stomach, but, oxidative stress,
Mhm.
all the issues. It's not just the stomach.
Right.
It's the and
Exactly.
second brain and all that too, but
Right.
you knew. I was like, "Okay, here's my mess. I'm a hot mess. Here you go, fix it." And it wasn't like that, but I know I appreciated acupuncture already, so I knew like, "Okay, Jen, here I am. I'm a hot mess. Just figure can you figure me out? What's going on? There's something there and it's moving over here." And
Yep, yep.
yeah, and so I just feel like amazing after a treatment with you.
I love that, and I find that people, no matter what they come in for, that is always part of their experience for the most part, where they leave completely relaxed and are surprised by it if it's their first time having acupuncture, and they can come in for a pain in their toe, and they come out feeling like they just had an hour massage because 'cause they're so relaxed.
That's the whole thing,
Yep,
and when you're relaxed and you reduce inflammation, all of your ailments go away.
yep,
So I feel
that's
that
right.
that's a big deal, and
Absolutely.
more than other practitioners that I've had to, "Hey, listen, we gotta just figure it out. That's it's not just the toe," you know?
Right, and so one of the things that makes biomedicine different from Chinese medicine is biomedicine tends to be more reductionist where it hones in on they try to hone in all the way down to the cell that's the problem and sometimes that is the problem. They do need to isolate a singular cause for a disease or a condition. But Chinese medicine was, first of all, thousands of years old, created before biomedicine. So we didn't have, you know, microbiology to explain some of the things. But what that system does and seems to be one of the best systems that is able to do this, also Ayurveda from India, is to look at the whole entire body. And that's what we mean by holistic because we don't wanna just treat your toe, we wanna know why did your toe become, say, inflamed? Let's say it's gout or, it's not just an injury, like you broke it or something like that, but we're gonna try to figure out systemically what is going on. We're looking for connections, we're not trying to separate everything out to down to the one little problem. We're trying to look and see how everything is interacting and fix the whole system to balance it.
Well,
and
bec
also the toe.
yeah, and the toe, but I mean, and of course, Western medicine is Western medicine, and we
Yeah.
need it.
Yes, we do.
And there was a time when I went one extreme to the other. Only Western medicine, only holistic medicine. I'm
Yep.
like, "Cheapers, you've gotta complement it." And, there's a place for both,
I totally agree.
but, sometimes I feel Western medicine just puts a Band-Aid on it with the medication.
Yep.
Or they say they're very textbook.
Yep.
This is what it is. I'm like, "No, that's not the same as my neighbor." My
Exactly.
neighbor has a gut issue or a toe issue. We go back to the toe. It's not the same.
That's right.
I might be holding on to something that my neighbors, like, could care less about.
Right. So if they do a study on, say, a Western medication and they have a good outcome, let's say 65% of the people, like in a double blind placebo test, um, do better than the placebo. That's considered successful. But I'm interested in what the other percentage, why didn't the other percentage of people with the same diagnosis, why didn't they respond to that medication? It's because we're biodiverse. And so
Mm,
what happens is, medication and um, like surgery, physical intervention in that kind of way are the tools that medical doctors have. And they can only go so far as the studies and the medications that they have
like, they go
that
by
are available.
statistics, just
Right,
statistics
exactly.
too, and you're like, "No."
So anyone who has a migraine might start off with the exact same medication. Okay, that one didn't work. We'll try another one. So they don't do as much of a differential diagnosis yet. They'll start off with sort of, let's throw this at it. Whereas in Chinese medicine, I mean, the side effects are different. It's lower risk. You're not going to come in for a treatment and have a negative response to the
Right,
acupuncture. It's either going to be the right treatment for you, or you might not notice a difference, or it might just take time before you notice a difference. But it's a lower risk where, medications have side effects and all that kind of stuff. So um, I think it's just different practitioners, different schools of thought have different tools to use. And sometimes acupuncture is just the thing, sometimes a medication is just the thing. But chronic
yeah,
illness
is not
is
yeah, there's more
it's
to it.
well documented that chronic illness in biomedicine does not have a great outcome as far as pain management is one of them. There's so many people in pain and chronic pain, and so many people that I wind up seeing after they've exhausted the Western medical establishment. They can't they either don't have an answer, or they have an answer and they've run out of medications that work. So then they come to me and they're, still in a lot of pain, and most of the time the acupuncture will help. Doesn't mean that it'll 100% cure somebody. Sometimes it does, but when you have 30 years of pain.
That's what I was gonna say, yeah, there's so
Yeah.
many years, there's other things that have happened because of the
Yes.
meds or because of stress from
Yep.
trying to figure out what the heck is going on,
Exactly.
um, and you get to the root of it, but I also feel that, like, if nothing else, everybody I know, including myself, if you feel relaxed, then a lot of your pain goes away, a lot of you get to the root of your issues because you're relaxed, because you're not, um causing more trauma to the body by freaking out and saying, "What is this?" And the medicine that will cause trauma to the body just
Mhm.
because you don't it doesn't agree with you.
Mhm.
So I think that if anything, go to relax with acupuncture and start there
Yep.
if you don't know what to do and come speak
Definitely.
with you, because it's just not you don't want you want to depend on you want to heal yourself, but you do need help sometimes, and I
Sure.
feel that, like, you'll figure it out for people.
Sure. Sure. And I was just talking the other day with someone. There's so much research on the connection between stress and illness. And I feel like with, Western biomedicine, it hasn't reached clinical practice quite yet. Um, it has a little bit, but there are actually there's books about medical doctors who stopped sending their pain patients to, say, like physical therapy, which I'm in favor of physical therapy. I'm not
Sure.
I'm not poo-pooing that, but I'm just saying that What they wound up doing was starting with stress management, and that actually
Yeah.
helped so much of people's pain. And I think we just call it stress, but I feel like we need better language to be more specific about the type of
'Cause
stress.
then it becomes a cop out. "Oh, that person's just stressed
They're
out.
just
Oh, it's
stressed out.
just
Yeah.
textbook
Yeah.
stuff," and I'm like, "No."
Right.
And I do know a lot of Western doctors who believe in holistic medicine and
Sure.
acupuncture, but they're not allowed to say it. Have you noticed that?
Ah. Well,
They're not allowed to in their network.
I don't know. I actually don't know what their experience is like as far as why they're whether they're saying it or not and why. But I
I'm
will
just
tell
saying
you,
I know
you've
for
had
a
that
fact. Yeah,
experience.
yeah.
Yeah.
So, yeah.
I've actually had, and it's been a couple of different teenagers where they had like concussions, say, and they have like post concussion headaches, and so for some reason the Boston neurologists seem to be way on board with acupuncture, and I've had several different people referred to acupuncture, not me specifically, but they found me and said, "Oh, our neurologist recommended that we do
That's
acupuncture."
amazing.
I
But
know.
see, that's what I'm saying, like, I know a lot of doctors are getting on board and
Yes.
appreciating you more,
Right.
but it's not there with the network and
Right.
all,
They can't give
certain
away their
they
business.
can't, yeah, they're not allowed to, but
Right.
they, on the down low, they're like, "Yes, compliment it with,"
Right.
especially, and it's ego too, and I'm gonna
Sure.
go that way and say
Sure, sure.
some of the other practitioners are like, "Oh, acupuncture won't work," because they don't wanna take it, like, away from them, and
Yeah,
I'm like, "But listen, if you," I said this last week, "If you're the smartest person in the room, you're in the wrong room." Like, learn from everybody
that's
and
true.
and everybody, all the other practitioners can help each other, and everybody would be that much better,
It would be
and then you
great.
help more people.
That would be amazing.
So
I just have
that's
this dream of having a big practice where you have, biomedicine, Eastern medicine, you have a whole bunch of different practices all sort of under one roof, like as a normal.
you could
And
you'll do
have
it.
we'll see. Well, I don't know. I'm more of a practitioner than a business person.
Well,
We'll see. We'll see. Um, yeah, so I mean, people definitely have surprised themselves when they come in for acupuncture how much they like it. I will say that.
yeah, that's awesome,
Yeah.
and it doesn't hurt, just so for
No.
people that don't know, and it's just, but
There's a big needle fear.
I know, but it's not even like I'm the biggest weenie as far as blood work and all that stuff
Oh,
when you go for
really?
your checkups. Oh my god, I can't even look, and they're like, "Are
Ah.
you okay?" I'm like, "Oh, yeah, I'm fine. I'm not gonna pass out or anything," like, there's a lot of people who have that fear,
Mhm, mhm.
but I mean, I'm just like, "Just do your thing, I don't wanna look at you," and the phlebotomist, they laugh.
Yeah.
It's not even remotely close to
No.
acupuncture needles. It's completely, it's not even, and if you wanna explain that,
Sure.
because it's just nothing like it, and it's just, you
Yep.
don't feel it, and it's just amazing.
Yep. So the needles that we use are called filiform needles, and they're just solid. So hypodermic needles have to be way thicker because they're hollow in the middle. So it's either for an injection or to have blood drawn, so some sort of liquid has to pass through that and has to have enough room to do that. Filiform needles can be way, way, way smaller, and people there. I can bend the needle, just by barely touching it. I can bend it right over. So I'll do that with patients if they're nervous and they want to see the needle, and I'll say, "See how
Oh,
flimsy this is."
cool.
Yeah, they do come in different lengths and they come in different gauges, so thicknesses, but they're all still tiny. And I think somewhere I read that you could put about 11 acupuncture needles inside of a hypodermic needle. And of
Oh my
course, there are different
gosh.
sizes and all that kind of stuff, but that's just,
Wow.
yeah. So they really are very tiny. People come in nervous often. They tell me, which I encourage people to tell me how they're feeling,
Sure.
because I want to ease their mind. I have anxiety and I like to tell people that if you're anxious or if you have anxiety, I tell people that I have it just so that they feel understood. If you I don't know, if you don't have anxiety, you don't know what it's like to feel anxious, and that is
Right.
it's hard when someone says, "Just don't worry about it," or "Just don't
Yeah,
think
yeah,
about it."
that's the worst.
So if
Yeah.
someone's coming in with this needle anxiety, but they're still trying to go through the process, I just really try to talk them, slowly through it, and we'll just pop it in and they'll go, "Oh, that's it?"
Yep, yep.
Like most of the time, like I said, I've been in practice for 18 years. I would say 3 people maybe 4 people just psychologically couldn't handle it. It
Yeah.
wasn't because it hurt, it was because they just could not handle the idea of having a needle put in them, but everybody else, I've treated babies, I've treated elderly people,
Yeah.
you know,
Yeah, there's no pain.
teenagers, no,
Yeah. Yeah, there's nothing.
none of them have a problem.
But I do know somebody that just the conversation of a needle, she'll never come to acupuncture because she won't get her blood work, she won't
Yep.
do nothing. I
Oh,
mean, the thought of I won't watch it on
yeah.
TV, nothing.
Yeah, it's not for her
It's
then.
just not for her. And I'm like, "Oh, it's so
No.
good though,"
I
you
know.
know?
I know.
And it is funny if you're like, you're the most chill person, and I'm like, "You don't have anxiety.
I
You
do.
couldn't." I know. But
Everybody says that,
no,
but
I
I don't
know.
know.
I'm like, you make everybody, feel very relaxed.
Oh,
So,
thank you. I
um,
try my best to
yeah,
make
and
it
that's
a
I mean, if you come
warm
in like
environment.
well, if you come in like a maniac like myself, then you're gonna be like, "What is" no. I mean, this girl is crazy. So, no,
No, I never had that impression.
no, I appreciate it. But I mean, I just you know what you're doing, and
Yep.
that's it's very basic to say, but it's like so many people don't.
Yeah,
With
yeah,
anything, even,
yeah.
with anything that they're doing. I'm like, can you feign interest? Can you feign know a
Right.
act like you know what you're doing,
Yeah.
But
Some of that is personality.
no, I know.
I think I'm a people person
You
naturally,
are,
so and
and you have a
I
great
became an
presence.
thank you. I became an acupuncturist because I'm very interested in helping people. So I'm glad to hear that that has come through with the way that I practice. But the
Yes.
training is it's and I know I mentioned that it's a master's program, but it's an extensive master's program, so it's actually a 4-year program. Most people do it condensed into 3 through full time through the summers. So it's because it's a medical degree, so
Yeah.
it's extensive. Let's just say that, and we do so much. You just learn endless amounts of things. Sleep, breathe, eat Chinese medicine for years, and so I went to the New England School of Acupuncture. They were the first school for Chinese medicine in the country. I
Yeah.
believe it was 1975 they started, and so there's a real there's some real roots here in the Boston area for acupuncture, which is cool. Um,
Medically, Boston is
oh yeah,
amazing anyways.
amazing,
Yeah.
amazing.
Yeah.
And then we have to go through a national board exam, multiple ones, multiple board exams, and we are licensed by the Board of Medicine. A lot of people don't realize that it's not a
That's
certificate program. We're
yeah.
actually licensed by the Board of Medicine. Yeah.
Yeah,
So,
and I was gonna ask you about that too
yeah.
because I know people don't understand how much is
Yes.
involved and that, you might as well be a doctor as far as I'm concerned
Oh,
because
well,
well, I mean,
thank you.
for your
But
knowledge no, I know what you're saying, and
Doctor of Acupuncture,
yeah,
maybe.
and we can't say that because
Right.
it's not medical, so we're not allowed to say that, but I'm saying is you have to study
You do.
as much as one would for somebody's health. I mean,
That's
that's
right.
just the way it is, and
That's
and
right.
obviously we can't say medical because 'cause you're not, and I'm not trying to get any myself or you in trouble,
It is a medical
but it
profession,
is,
though.
but
Yeah.
it is a medical profession
Yes.
that you have so much, knowledge and so much, studies and continuing education and
Yes,
everything
we're
that you do,
always doing that. Yep.
yeah, for that reason, because it is not just, like you said, a certificate program, and